We are at the NOC 2016, which is in Birmingham at the Metropole Hotel, and we have representatives from the whole of primary care here, so from multiples through to independents. We've got primary eye care companies, we've got representatives from the colleges, Abdo, Photo, so effectively who's who in primary care. We stand on the brink of a real change, What we've seen through the presentations were ideas that turned into services that have now gained traction and are starting to really see change, activities moving forward. We are seeing a shift in the primary care model. We're at a kind of crux in terms of the way in which primary care services are developing. Hospital services are becoming really overwhelmed with demand, and through the primary eye care model we've developed services for what we call extended primary care services to deliver more in the community or to deliver more in primary care, which means the patients can be seen more quickly and they can be seen more effectively, and it has the result of decompressing hospital activity and either creating space, or if commissioners wish, they can make those departments smaller and make financial savings. So we're here to learn more about the process, to understand how we need to take that forward, to understand how new changes to the commissioning regimes across England in particular with the sustainable transformation plans, how they will impact on services being commissioned, and to find out from different areas in the country that we don't see day to day what's happening and where things are working well.
Research has been a big focus for the NOC, both in terms of audits of local services that have been delivered. The Devon audit of the Plymouth glaucoma service was really interesting in terms of proving the safety of optometrists delivering these services in the community. We also had some great feedback from the College of Optometrists Enhanced Services Research project, which has been really pivotal in bringing some key evidence to the sector. And LOCSU was able to update delegates on the outcomes of the National Data Repository, that we're able to bring together the data from services across the country that are delivered by LOC companies and be able to show the evidence of the outcomes of these services, not just in terms of the clinical outcomes and onward activity, but also in terms of the patient satisfaction. There was a resounding message from all of the audits that we heard today that patients and the public are very happy with the services that are delivered in community optometry. We have a real opportunity, we have a real service to sell, and LOCSU centrally and also through the local commissioning teams will support you in any way we can in order to do that engagement piece and in order to push those services forward. The take-home messages that Richard delivered at the end of the conference really today are about getting out there and engaging, but engaging with the new world. So whilst this time last year we were still very much focused on individual CCGs and also then starting to look at acute trusts, I think that was my take-home message from last year, get out there and speak to the eye hospital departments. Then now we've got sustainability and transformation footprints, and that gives us scope and potential to get services delivered over a larger footprint. And our main focus working with the LOCs is to be out there talking to the leaders of the STPs and driving forward the primary eye care services. Go out and engage. We've got the model, we've got the workforce, we're starting to get the evidence. What we need to do now, collectively, is go and make the case. Go and talk to people. The energy that's come out of this, the last 2 days, has been brilliant, but we're talking to ourselves. What we now need to do is use that energy and project it outwards. So this is my last year as Managing Director of LOCSU at the NOC, but I'll be really looking forward to moving into my new role as Clinical Director. Richard Whittington, who's our newly appointed Chief Officer, and I will be working on the transition over the next couple of months, and I'm really confident that together we make a fantastic team to lead LOCSU and the sector on the way forward.